Why I did this, I don't really know, but I at some point started taking a stimulant medication to help me, thinking it was going to help me focus or get
Yeah,
more
well, I
time
mean,
with
why the
24 hours.
surgeon took cocaine, right? We know
Yeah,
why
and
they
and
take
then
it, right?
and then actually it was very similar. I was joking with somebody else about this. I was like, I almost feel like maybe I'm not. I mean, I'm not going to try and say I'm nearly as brilliant as Dr. Halstead, but I kind of had that same mentality about like, okay, I'm going to take the stimulant and get all of this work done,
Yeah.
stretch out those 24 hours as much as you possibly can, or get as much done in that period. And oh, shocker, like I can't sleep because I just took like basically, oral cocaine. There's one person out there who especially like the Courtney from 3 years ago, felt so hopeless and alone, and like their career was their life, so their life must be over. I'm talking to you, so if I can just help like one person, then this is all worth it.
Hello, everyone. Welcome back to the channel, or welcome to the channel if you're new here. I'm honored to have with us today Dr. Courtney Barrows McKeown, and she is a board-certified general surgeon who is going to tell us her story, and it's about addiction, recovery, and hope. And I'm so grateful and honored that she's here to share it with us because it's going to help so many. So, Courtney, thank you so much for being here.
And thank you, Jillian. I'm really honored to be asked to be on your podcast. I've been a fan for a while now, so it's really great to be here and speaking with you tonight.
Yeah, and I mentioned to you before we record, I've listened to your podcast with Dr. Amy Vertrees 3 times because every time, like, there's so much that I resonate with it, and I just know people tuning in here that are gonna need to know that they're not alone, and they share some similar things that you have gone through and that you have processed through in your current journey. I'm just so thrilled in a way that is knowing that hearing one story can save lives, and I just
Absolutely.
am really appreciative of you doing this.
No, I appreciate that. And I mean, honestly, that as we were talking earlier before we recorded, is just that, my initial goal in all this was to, I'm fortunate that I'm in a position now. I just celebrated 3 years of sobriety about 10 days ago. And
Congratulations!
thank you. I know. I was like trying
Amazing.
to, yeah, it's funny. It's like I'm actually more proud of that than I am of probably any of my, academic
Yeah.
little career milestones. I mean, this has been the hardest thing I've ever done, and not because of not the, like, laying off of the substances necessarily. The getting off was hard, but now it's more just about, like, being in recovery is like a lifestyle. It's, dealing with life on life's terms and trying to be a better person, be a better human.
Yeah, and
And
defining, and we for certainly go into more of this, but I think defining what recovery looks like and what it's not. And before we dive into what you've been facing from like a medical standpoint and career standpoint, when it comes to people's stigma and perceptions of recovery, I'd love for you to share some backstory about yourself and your journey into general surgery.
absolutely. So just I'll give, like, a brief, maybe 30,000-foot view, and we can obviously delve back into the little specifics, but, so I am a general surgeon. I, grew up in Massachusetts, about 30 minutes north of Boston, and I'm the oldest of 4 children. Had a really good childhood growing up, although looking back, I was always, like, super anxious. I mean, they didn't put a label on it back then. It was just I was shy. And I think also, I was talking with my mom a couple weeks ago about some of this stuff because, it's hard for her as a parent sometimes to hear some of the things I was thinking. But she was always wondering, like, how did we miss something or whatever. And I internalized so much, like even as a little child. Like it's crazy how much little, I don't, there was something different about the way my brain is wired. And I felt like I was more in place. So the further along I went in my career, which probably means, a lot of us, it was like the imposter syndrome and the perfectionism. I was always a really good student. And in the, rare occasion when I was younger that I didn't get a good grade, like my parents never even really yelled at me because I would be so much harder on myself. And I was similar with sports. So, I grew up, I played soccer, basketball, and softball all through, all the way up to high school. And basically any one point in the year, I was playing all three of them, between like AAU and club and all that. And I think the reason that's important just because I think my entire childhood or young adulthood, I was always on like a very structured schedule, and it wasn't like I had like helicopter parents, but it was just naturally that way because of how busy I was. And when I wasn't playing sports, I was studying or practicing sports. So, anyways, I went to Boston College and then had a couple of years where I did some research. So, I was sort of living in the semi real world for a couple of years before I went to med school, trying to get my resume beefed up because I did fine in college, but not like med school fine. And actually had an advisor in college who said I should not bother applying to med school. So it's funny. It's like I feel like every time I do really well, it's usually because I'm just coming off of like somebody telling me I can't do it. I'm like, all right,
Mm.
challenge
There's that,
accepted.
yeah, there's a sports competitive nature
Well,
too.
yeah,
Like,
sometimes it can get a little bit out of whack too, which I think some of the things that served me well also
mm,
were my downfalls as well. But anyway, so I ended up getting into med school, sort of at the last minute. So I went to New York Medical College, and I did really well there. I was in the top like 5 people, I think, in my class of 250. That was, of course, very important to me because I was very achievement, I think, was probably honestly my first addiction. Just that feeling of external validation. I think it definitely gives you a dopamine rush. So once I had figured out, okay, I'm doing really well in med school, I was figuring out what I wanted to apply into. And I really loved surgery. So, yes, so I had, decided I wanted to go into surgery. It honestly wasn't a really hard decision. And when it came time to apply, this gets back into that whole achievement mindset and stuff like that. I never considered actually community surgery at all. It was like, okay, well, I need to go to the best possible program. And of course, when you look at whatever US News or whatever ranking you want to use, right? All of the top quote unquote residency programs are all academic. So, like, I was already setting myself up for that. Never thought that there was another way.
mhm.
And like, I also, there's that name brand prestige thing that, like, looks all shiny and something that you can have family members and friends brag about. Those are not like real, but
Yeah.
that at the time seemed like I could
Mhm.
tell it drove me when I like look back on things.
I want to pause there for a second because
Yeah.
during oral surgery application, when I was interviewing, I came from a small school, really great education, but it wasn't a name brand for dental school. And during the interviews, I saw people had their binders with like Yale and all those Ivy League schools. And in my head, I'm sitting next to what would become my program director. And he said, if you're in the room, you belong here. Like, you're here for a reason. This is a mutual interview. My head was like, except for me, you know? And I was
Oh,
like finding
I hear
all the
you.
reasons because I had associated, well, I went to a small college and then I went to a small dental school. They were perfect fits for me. But because I didn't go to those Ivy Leagues, I, that amount of pressure on myself certainly led to self-sabotage, and I'd love for us to explore for people that are currently, we have so much to talk about today, but when it comes to coaching and like the perfectionism of how perfectionism serves us and how it can become a self-sabotaging behavior, as it certainly did for me. I'm
Perfect.
curious what your perceptions about your perfectionism and how it might have led into your anxiety or what your thoughts about that is.
Yeah, I mean, I am 100% on the same page with you about that. Like, there's a part of it, and maybe that's not even considered perfectionist once you get to the part where it's like functional. I don't know, like whether you call it a disorder at that, once it becomes more than that. But yeah, I mean, there's obviously, especially as a surgeon, we take a lot of responsibility for our patients. It's challenging. It requires us to perform under pressure. I think as a resident, especially, I never wanted to be that resident that would come into a room and like the attending would ask them something, especially if it was something that was actually relevant. Some of them just their questions are ridiculous,
Mhm.
and I'm like,
Mhm.
I could, I would still feel a little crappy if I didn't know it, but I was like, there's like literally no reason you needed to ask me that question.
Yeah.
It's not
Mhm.
has anything to do with me being prepared to do this operation on my own. But I always over prepared. I mean,
Mhm.
and I remember thinking even in residency, like, I could tell there was something not normal about me, like, stripping the addiction stuff aside for a second, even as a fourth year or chief, I had already done very well in the program and like, I deservedly had some respect. So it wasn't like I was always trying to I don't know, like I felt like I didn't belong. Like I kind of like knew I was good. even so, when I came time to like, say an intern or second year goes to see a consult, they staff it with you, and then usually we had a very, I had a good residency experience, but it was very traditional in terms of hierarchy. So like, we would never have an intern call an attending. So they would staff it with me, and then I would staff it with the attendings. And the amount of preparation I would do in advance of like, even just the most routine phone call was like way overboard. And I would notice that like my other coach, like whether it was coach Eve or like other residents even before me, it's like they don't seem to be like as stressed out about calling, and it wasn't even I would feel just as like anxious when I would call like my former, my program director, who was like the most supportive, nice person ever. I could have probably said like the completely wrong thing, and she would have been like, well, maybe we'll do this instead, not like chewed me out. So
Yeah.
it didn't even matter like who I was calling necessarily. Like, I mean, I might have been more anxious with like the meaner ones, but I always remember that was abnormal. I was like, this, and it's also like probably a little inefficient, just like then I would work longer or whatever to make up for it. But I remember that, ooh, there's something like a little bit out of whack
I'm
here.
totally the same
Like,
way.
I don't feel
Yeah.
like
I'm
they're so
exactly the
chill.
same way. And
Yeah.
it even like board exams, like I have to over prepare and then you never think you're ready. And then if your confidence is low, you actually perform worse.
Oh,
So
yeah.
it's like, had
I
we
know
just
about that.
trusted, I am, and I know so many other people relate too, where like the way to calm anxiety is through over preparing and at what cost.
Yes, because I think ultimately at the end of the day, if the over preparing, like there's still going to be something you miss, or just like that you're caught off guard. And especially if it's like where you're a trainee, you can't always predict like what they're going to ask you. So, you're just setting yourself up for failure. It's like, oh, well, I did all of this and now I'm still don't know anything. It almost
Mm,
like feeds into the
mm,
imposter syndrome. Like, well, I'm really not
yes.
good enough then if I tried my hardest and I still got the wrong thing.
This
Um,
is such a good point because what are you protecting yourself from when you're over preparing or spending so much time preparing?
Shame, embarrassment, like I honestly, like externally, it was really funny because I always felt I was really like truly wearing a mask. I mean, a lot of times, even recently, I've had, some of my friends from residency come back and be like, I had no idea. Like you were always just so, like, I think the ones who really knew me did know I was like anxious, but like, it's like, don't let them see you sweat. That was
Yeah.
the motto. Yeah. But then at the same time, like I almost was getting validation from it because then everybody would think I was good. So I was like, okay, well, this seems,
Yeah.
I think the
That's what
problem,
sustains it.
well,
Mhm.
yeah, it sustains it. And then what happens is like, and I think that this is part of my downfall in my fellowship was that I wasn't getting that same validation. And it probably, like I don't think I brought my best self there for a number of reasons. I think I honestly could see how that was now counterproductive because now I was like basically not getting the validation I needed to get or I thought I needed.
Yeah.
Um, and every time, it would just like add on to my like anxiety, which eventually like snowballed into more. Yeah. I mean, I think if I had gone in there with, first of all, a good recovery foundation, but also a good just mindset about stuff, like I forget who it was, but like I've been doing a lot of, reading like or growth kind of books, and somebody talks about being unfuckwithable.
Oh, yes.
Heard that term
Mhm.
before? Like, I wish
Yeah.
I was like that, like if I had gone in like with that mindset, like,
Yeah.
or just like more confident too, just the way you carry yourself, like it almost people can smell blood in the water usually. And
Yeah, and I would love to hit on this because people are gonna relate a lot, and I think this was the pitfall to what actually ended my surgical career is because I felt I didn't deserve to be there. Same reason, like I had all this validation, hadn't really failed at anything until I get into surgery, and I was doing well according to my program director, but mentally I was like, I don't deserve to be here. I don't belong here. So I looked for ways to validate that was true. And I remember the questions I got asked in the OR that I didn't know and how much, because we remember how we felt.
yeah,
Right. And had I gone back now, and I'd love to hear what your kind of lessons to your former self were, but had I gone back now, had I learned self compassion and had a way to reframe that and had a growth mindset, I was very rigid, black and white. I'm good or bad. It's right or wrong, and I had no self compassion. And I thought in order to become mentally tough, you had to break yourself down and just keep building yourself up. So even back then, it was 2014 to 17, my program director told me I was one of the most resilient people he ever met. And I know resilient is a really big activating word for us right now. But I was like, yeah, I just kept getting back up because that's what you do. But then recently I heard Brene Brown came and she was at a conference doing
oh,
a
I love her.
keynote. Yeah, I went because, I had been reading her work and I'm like, "Oh, it's really
Wait, so
helpful."
you heard her speak, like, in
Yeah, I
person?
was front
Wow.
row. I was front row. I was like, "I
Of
gotta
course you
hear
were,
from
of course you
from
were.
your face." I'm like, "I know you're just a person, but your words are so helpful. Please speak to my face." And so she said that in her research, she found that the people in the military and just people in her research found that the ones with the highest levels of mental toughness, what she found is that they share the trait of self-compassion. Not, "I'm
Mhm.
gonna beat myself down and then build myself up." And then she said for the people who are able to sustainably give compassion for others, what they demonstrated were strong boundaries. I'm like, why didn't you give me that talk in 2014? you know, because
Yeah.
I find that lack of self-compassion can lead to people wanting to take their own, not wanting to, but can lead to people thinking that they're unworthy of living and taking their own life, because that's what it was for me. That's why I think it, because that was my true experience. And
Yeah.
once I learned about self-compassion, it wasn't right away that I developed it, because you're like, "I don't even deserve this," right? It's like
Well, yeah, and I
self-worst.
think my thoughts that I used to have about self-compassion, I don't anymore, but it was like, I equated it with, like, letting yourself off the hook,
Exactly.
like, not taking accountability for things, and obviously, that's not what it means, but in my mind, it was always like, well, if I got like, say I got reprimanded for something or kinda like, I didn't know something and got some, like, condescending comment from, one of my attendings or something, I would be like, "Well, I should have known that," or whatever, "I need to prepare better next time." And I was like, "Well, if I was self-compassionate, I would just be like, oh, la, 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 that no big deal,' and then make the same mistake." That's
Mhm.
clearly like there's not an alignment there.
Yeah. Mhm.
Yes, I mean, I 100% agree. I think I could have benefited along, and that's honestly something I'm still working on, which is why I think me having gotten involved in coaching as a coachee, so to speak, the last few months has been a huge game changer because I've been able to be self compassionate when it comes to my personal life slash addiction history, but I still noticed that I would fall into that trap of not practicing it at work when it came
Mhm.
to doing a like, being an early career surgeon, especially, everybody knows the pain of that first few years probably of practice. And I've only
Yeah.
really one like at this point, but every case you just, takes longer and you're like, oh God, I had to call somebody in again.
Mhm.
I could feel myself falling into that trap. I was not nice to myself. Something I'm still figuring out. And I'm certainly more functional than I used to be. But yeah, I think it's definitely key.
Even speaking about addictions, right? I shared with you and on this channel, I know have had many times where I was impatient for anorexia, and then you get discharged into the same environment. It's like I learned all these coping skills, but then I was discharged in the same environment where I had all the maladaptive ones. So
Right.
it's, we're unlearning it while like you're practicing it at home where that environment is more conducive to that practice. And it takes a little bit longer when we're having to unlearn while in an environment where the people around you aren't unlearning that necessarily, right? If you can be in the
Right.
environment where that stereotype is upheld, and not only that, but the people aren't all in coaching. They're not all changing their beliefs around self-compassion. They're not all changing beliefs on the work hours. They're not all changing belief on the stereotypes and trying to figure out what you truly believe and what's helpful to you. I imagine is, just a process and a journey.
Yeah, and I think as I've become more self-compassionate, I've also then subsequently developed more empathy for other people, like both
Mm.
colleagues and patients. But since I again got a little off track, I'll just to get back into so again, I went to Beth Israel Deaconess for my residency. Um, and that is an academic program. It's one of the Harvard hospitals in Boston. So they have you do at least 2 years of research in general. It can be a little bit flexible depending on individual circumstances, but you kind of like sign up knowing that's what you're going to be getting into is like a 7 year general surgery residency. I was there for 8 years. I did 3 years of research and I went out after my PGY3 clinical year. Residency overall for me was a pretty positive, experience because of mentors I had. It was very supportive. And so I don't have a lot of those horror stories that I've heard out there I know are true
Mm.
as far as other programs. I think in surgery residency, there's always going to be some, I mean, I'm not saying it was all sunshine and rainbows. Like I definitely had a few toxic encounters for sure, but like by and large, there was support. You always felt you kind of they had your back. So my first 3 years went well, went out in the lab, and that's when my addiction issues became apparent to me, at least. I was working in a research lab where I was doing some translational research, developing some tumor models. Also was the administrative resident, so I was, doing the scheduling and putting out fires, and I mean, that in and of itself is almost like probably like a 75% FTE. So yeah, there's a lot of moving parts. And long story short is I just felt like overextended. I mean, I was in this translational research lab, which I should have, I think in retrospect, was not going to be a good fit for me. I kind of did it because I felt like, it was sort of proposed to me. Like, I think I could have said no if I wanted to, but I was sort of drawn to well, this is groundbreaking stuff and we can publish in Nature. And again, that gets back to that,
Yeah.
achievement, prestige kind of mindset of things like, name brand stuff. But I also knew, having worked in translational research, it can take quite some time sometimes to
Hmm.
have a publication, and sometimes you may have none. So I wanted a guarantee for if I was going to be out for 3 years. And so I started doing some outcomes research as well. So many of these things, like totally unrelated to each other. You can imagine how that would, just, you feel like,
All over. I'm
just
going through that
all
right
crazy.
now. Boy, do I get it. I think for people who are in that right now, it's really identifying which things in your life actually take priority. When we think about perfectionism, I think we're always going to strive for excellence, and like
Hmm.
what things require the excellence. And like my laundry folded, I
Yeah.
don't, I actually don't fold it. Most times I leave it in the dryer until I wear it. So like those things, I just got used to myself doing that. I'm like, I'm not going to judge myself for it.
Right. Like, I mean, I think like, and I haven't had children yet, and just have a four-legged child for now.
Yeah.
But, a lot of my friends who've had them, or even just, some of my mentors who have kids, it's like they say that you have to just accept that you're never going to be, um, like you either pick one thing that you're going to be like, great at, and I understand that you're going to be less good at the other thing, or whatever it is. It's like you can't be perfect in all of the things.
Yeah.
So it's like a give and take. But yeah, I couldn't accept that at the time. So
Hmm.
why I did this, I don't really know, but I at some point started taking a stimulant medication to help me, thinking it was going to help me focus or stretch, get
Yeah.
more
Well, I
time,
mean, why the
24 hours.
surgeon took cocaine, right? We know
Yeah,
why
and
they
and
take
then
it, right?
and then actually it was very similar. I was joking with somebody else about this. I was like, I almost feel like maybe I'm not. I mean, I'm not going to try and say I'm nearly as brilliant as Dr. Halstead, but I kind of had that same mentality about like, okay, I'm going to take the stimulant and get all of this work done,
Yeah.
stretch out those 24 hours as much as you possibly can, or get as much done in that period. And oh, shocker, like I can't sleep because I just took like basically, oral cocaine.
Yep.
And now I'm going to drink a bottle of wine to fall asleep. Got this snowballed very quickly. So, when I first started taking it, it did help me focus a little bit, but then you develop a tolerance, and that generally doesn't happen to people who have ADHD. It usually, like, they stay on one dose, and usually it's a small dose and it works. And somehow there's some sort of a counterintuitive effect of like making them less hyper too. That definitely wasn't the case for me. It's like, if you can obviously I'm a little bit of a fast talker and I can get off track. So like, can you imagine this on like, 100 milligrams of Adderall? Like that would be
Yeah. I,
pretty crazy. And I
yeah.
imagine it probably did look pretty crazy. But that's what happened, is that, again, it just, you don't get the same effect out of whatever the dose is you start at, and then you take more of it. And I think that most people are not, people who don't have addiction or addictive personalities, maybe um, this part of our, our nerve is probably where our brains differ, is that I was always chasing that, like kind of the euphoric effect of it too, and needing to take more of it, and all rational thought goes out the window. Like, obviously, as doctors, we know what this medication does and what the side effects are, and you don't even think about that. Like, I mean, the doses I was taking it at, I could have just as easily had an MI as I could have had. What I did have was a psychotic episode eventually. Um, but prior to that, it was already snowballing, like in terms of me having panic attacks. So I've definitely, I have since been diagnosed with general anxiety disorder, which I've always had for sure, but I never had panic attacks before, and that was something that was new with this medication. Um, so that was, and that was a little bit disturbing. I wasn't able to put in, presentations together very well. I was late. I gained weight. I probably sometimes came in looking a little disheveled. Yeah, eventually it turned into a psychotic episode where I literally had no control over my brain, and you have these crazy paranoid delusions that you think up, and that required me to be hospitalized in like one of those kind of acute inpatient psych hospitals, not like addiction focused at all. So that was back in like August of 2017. I was there for about a week. That I think started my first journey into sort of semi recovery. I had to sign up with the physician health program in Massachusetts, which is known as Physician Health Services. When I had the psychotic episode, I had basically been calling attendings that I worked with and other people because it was a lot of my delusions were surrounding work, like surprisingly, not really.
Yeah.
Um, and
Our whole
so
life at that point, right? Like, what else would it be
I
about?
mean, what else would it be? Yeah, it's like not really my home. I did think at some point that my PI was trying to kill my dog, but that
Hmm.
was like still also part of the work thing.
Interesting. Yeah. Interesting.
But anyway, yeah, so like it wasn't like a secret to my program director that that had happened. So I had to meet with her when I got back out of the hospital, and she had arranged for a lot of things. Like one was she did want me to get evaluated by the physician health services people before, especially before I went back into residency. And then again, she also talking about not getting placed into that same environment that was like a huge stressor for you. I mean, I that first meeting with her was like, you don't have to work with this person anymore. We arranged for your salary to be paid by the department. And, I want you to focus these next 9 months or so on self care. And, you can do some research with me and if you want, but like, you don't, basically it was like she was clear on like what the priority should be for me.
This is huge. I want to stop on this for a second
Yeah.
because that was how my program director it was had he not cared about the human first, I wouldn't be here. And I find it to be so extremely valuable. So for people that don't know, your research year was funded by the PI's grants. And so it's important that, a lot of times they're like, well, sorry, we can't fund you. So we're going to let you go. Or, I'm currently funded on a grant. And so there's always this risk. And for her to step back and say your life and your well-being is more important than putting you right back in that environment and we're going to figure this out. That is amazing.
Yeah, no, definitely. Even then, even though my brain was like not totally back to normal, I was like, okay, well, like I know I kind of at that point knew I could trust her and stuff and
Yeah.
like it was sort of a safe place. And again, she also, you know, I mean, I clearly needed to be in a PHP based on what happened because again, she wasn't sure if it was like this was a first presentation of like a schizophrenia or like
Yeah.
what it was. And regardless of what it was, someone who is a professional needs to evaluate me and make sure I'm safe to practice again. And so that all made sense. But it never felt, at least when she said it to me, like it was going to be a putative thing.
Yeah.
I had kind of like a so-so experience in Massachusetts
Mm.
with the PHP, but you have to also understand I was not happy to be there.
Yeah.
I didn't think I needed it, ironically enough, because in my mind I was like, "Oh, I made this mistake," but like, I'm not like a homeless like all the things you equate with like a person who suffers from addiction, I had it all stigmatized.
Yeah.
And it was like, "Okay, well, I have to do this because I want to go back into residency. I want to finish." And so it was really about like, "Okay, well, I'm going to do this because I have to, not because I really have accepted um my I don't know my fate, but like, that this is just who I part of who I am." I mean, I have it on both sides of my family, not in my immediate family, which is maybe how I sort of like I don't know, I don't think it would have changed anything necessarily, but like, it was I didn't really realize the extent of how much it was on both my mom and dad's side until like my stuff came up.
Mm-hmm.
But that I think speaks to, it's not obviously 100% genetic because I'm one of four kids, and my other siblings, as far as I know, don't have that issue. So the other thing I'll say is that I think there's sometimes, and I've heard one of the things I was really scared about when I went to get evaluated by the PHP was that I had heard from people like, oh, they're going to make you do some like 30, or sorry, not 30, 90-day, like, physician only, inpatient place. They're not going to take insurance. And I mean, I had graduated with like 300 grand in loans, because of, my med school was private. It was, expensive. And so like the concept of like having another 50,000 or whatever it was going to cost, like, was terrifying. Now that sometimes is necessary for some people, I guess. I will say that they were fairly flexible with me. Looking back, whether they should have been, I guess, I don't know, but they did offer me a few choices. A couple of them were those really expensive ones. But there was also an outpatient option at McLean, which is, for people who don't know, probably one of the best psychiatric hospitals in the country, and it just happens to be, just outside of Boston. So I was able to do like a 6-week intensive outpatient program. I think that one of the things that probably helped in terms of like that being an option for me was that I didn't actually like present to them until I was already like 2 months or so, like, from that initial incident. Like that was 2 months of
Mhm.
me not taking that medication. I did start drinking again because I don't know why not, but at least that was my mindset at the time. But it wasn't necessarily like pathologic amount. So they did give me that as a choice, and that's obviously what I took because when you're a resident, how would you pay for that? That's actually
Mm.
one of the things that I'm passionate about now in terms of like advocacy stuff is trying to reduce some of the barriers to treatment and good treatment.
It's
But
so that it just parallels eating disorder. I was actually denied life-saving care from an eating disorder facility because I was active duty military and had TRICARE. So I feel this for the depths of my core is that it
yeah.
makes it inaccessible to so many. PHP can stand for is a physician. What does it stand for in that sense?
Yeah, so PHP stands for a physician health program. Now, a
Physician.
lot of them, and they're in 47 states plus DC, so not every state has them, but almost everyone does. And oftentimes a lot of them though, I mean, physician, obviously that by definition, like physicians, but there's also oftentimes they cover other
Mm-hmm.
specialties within healthcare. Like, I know in New Hampshire, I mean, God love them. I think Molly Rosignol, who's the director, said they have like 13 different occupations, like, I mean, veterinary, dentist, but then nurses, occupation, like all of the, like anything you could think of probably as a healthcare provider. So it depends on the state. But like, they at least cover physicians for sure. And yeah, so they usually what'll do is evaluate you and determine, they recommend people who evaluate you, I should say. They kind of don't do the treatment themselves or even administer the evaluation other than getting a history. They'll then usually have you do an independent evaluation. Now, again, mine was actually being able to be done outpatient. Sometimes, though, people do get sent places for like a few days. Um, I didn't have that happen, so I can't speak to that. Those are pretty costly though too. I mean, I think I've heard people say 10 to 12,000 for a 3-day stay,
Wow.
and I think that's where sometimes some of the what's the word? Maybe resentment or a little bit about some of that comes into play. But I'll just stick to my experience, and that was I had an independent person evaluate me. That was not cheap though. I would say that was about $1,000 or something. So those people, like, oh, maybe I went into the wrong career.
Yeah,
Career.
I
If
know.
they all take just like cash. Uh,
Yeah.
but so then they kind of give their take on like whatever your diagnosis is, and then the physician health program will like say, okay, like here's what we would recommend then for treatment, and then you would go to those places for treatment. Once you do the treatment, they'll have you sign, assume, and not everybody, by the way, even requires treatment in their perspective. I think, like, I don't know what the stats are in Massachusetts, but I've been collaborating a little bit with uh, one of the directors in a different state on some work, and I think his stats were like 40% of people actually don't even need anything ongoing. It's just like, okay, they're fine. Maybe they should do some stuff on their own, but like they don't need to be monitored for a number of
Mm.
years because people can, they basically evaluate you, anybody who has like a potentially impairing condition. So certainly substance use disorder, which is a mental health disorder, is a big one. But non-substance use mental health disorders also go in there. And then, more lately, more they've even been dealing with some like age-related cognitive stuff, things like that. So anything that could potentially impair you, they would, do that. So in my case, clearly, I think, anybody can probably see based on what happened that I would need to be monitored for a number of years. So most states are 5 years of monitoring, whether it's for mental health or substance use reasons. In Massachusetts, it's like one of the couple states that do a 3-year program, unless you were referred to them by the board, which, that would be 5 years. But at that time, important to know, because I, agreed to work with them, and there weren't any allegations of any patient harm or anything like that, I was not known to the Massachusetts Medical Board ever. I mean, now I am, but at that time, everything was confidential as long as I was compliant with my contract terms, which involve like regular drug screening. They obviously screen you for your drug of choice, but then probably like, I don't know, 10 or 20 other substances, including alcohol. And alcohol, they have these, biomarkers that will go back like 3 to 5 days. So it's not like, you know, just the standard, urine alcohol people are used to. Both the things I think that were most helpful were probably the needing to have a psychiatrist who has specialty in addiction, as well as a therapist, same thing, meeting with them regularly. So, I think everybody probably could benefit from seeing a therapist, whether, especially when you're in residency, to be honest,
Oh
but
my gosh, absolutely.
right.
In medicine, we're always taught to shove things in, right? To
Oh,
kind of
yeah.
come across stoic. And even if you wanted to process, like going from if you had an outcome, and you're talking about you're in Amy Vertrees program, and she talks about like managing complications in your mind, right? And so you're
Right.
not spiraling down, but having an opportunity to process that, to learn from it, to feel the emotions and go through it. Because I know for me, the eating disorder often comes from I internalize things, and then it's like this manifestation of all of those emotions inward are overbearing your coping skills. So
Right.
oftentimes it leads to whatever your addiction is.
Yeah. No, and I totally agree. Like that brought up a good point. We have this culture of like everybody, or where did I hear this? I heard this in some podcast. I think it was like on Adam Grant's or something. And somebody was talking about like how we live in this culture of pundicy, pundits, like, so
Yeah.
everybody wants to like say what's wrong with something. And then very few people, though, like a very small percentage of people, it's important that we point out problems, right? But like the ideal situation is we point out problems and maybe even if we're not right, like have some sort of idea of solutions or like,
Yeah.
and that's something I appreciate a lot, and why I'm sometimes careful with my words, because if I don't know how it could be better, I hate to complain about it, I don't know, and that's just part of who I am, but like just general idea, like why doesn't this somehow be built into training programs where like you just have coaching as part of it,
Exactly.
like coaching outside
Yeah.
your program though, which is very important
Mhm.
because you need to feel like vulnerable enough to be able to talk about things, and like what they talk about in coaching, and in Dr. Vertrees's coaching sessions, permission to complain is important, get it out there. It's like, and then we say, okay, well, like, yes, which things can we control? Like, obviously, our system is very screwed up right now. Like,
Mhm.
I'm not even talking about training. I mean, some of it is, but like just medicine in general, right? It's so messed up right now. What parts can we actually contribute to? And some of us have ability to maybe make some changes eventually, but for now, like how do we armor ourselves so that we can basically survive, maybe even thrive, dare I say, in this environment, while we're also, maybe we and other people are working on improving, imparting positive change so that, it's not something that we leave to the next generation to struggle with too. I think it's like what if we did yoga and we changed the culture? Wouldn't we all be
Yeah.
then? Yeah, like
Yeah, I did start yoga. I do some lit review with integrative medicine. And so they have inspired me. I actually started meditation and yoga, and it was funny because I was averse to it because I'm like, this isn't going to help. Or even coaching, I think original skeptics is like, why would we change? Right. Like, we don't want to,
right. And that's
but
why I said yoga, because like that seems to be like the common thing, right? Someone's
yeah,
like,
go
yoga
for
is
it.
not gonna and like I
It's,
don't mean to be in any way like I'm not mocking that mentality because
yeah,
it's true. Like we can't just cover everything up.
yeah,
Like what if we could do both and then wouldn't
yes.
people be better for it? Not, I mean,
Y-
I should get back into yoga. I did it for a while. The point is like
Now
we
we're
put
judging
ourselves
ourselves.
in that.
Oh yeah, no, but I
I know.
think this is such a strong point because I find that getting it out is important. I actually had to take myself out of burnout meetings that weren't proposing solutions because it was making things worse for me. So like there's
Yeah,
some
me
groups,
too. It stresses me out. Like,
yeah,
okay,
it stresses me
here's
out
one
too.
more screwed up thing than the system
Yes.
still in right now. Great.
Yeah. So, because we get that learned helplessness, right? And it can turn into hopelessness. And so, coaching often provides you that what's in your agency, like that's what you were showcasing, is like what is in our control. And while navigating all the things that are outside of our control, because if you see what's in your agency, for me personally, I found it gave some reprieve to that hopelessness and that sense of being trapped and like, oh, actually, and it was this good stepwise fashion. Because if you're exhausted and you're in that deep depression, it is really hard to start thinking, going from like depression to positive thoughts, right? It's like, but maybe
Oh
things
yeah,
could be
yeah.
different, right? That's like the first stage is
Right.
maybe things don't have to be this way.
Exactly. Right. And I mean, we can I think it's important to get that complaining out there, but then it's like, okay, like I like that also the concept like, well, we can't argue, same things that are like life is not fair, right? Like there are things that are screwed up
Mhm.
and not fair. But if we try and like only come at it from that aspect of like, then we're putting ourselves in the victim role and also we're arguing with reality, right? Because like whether we like it or not, we can work on changing this hopefully, but there is, gender bias. There is like these things exist and like we're not going to in one fell swoop get rid of those things. Same thing like with stigma and addiction, and that's what I like about coaching and recovery. They actually feed on each other very well because these same concepts, it's like the whole serenity prayer. It's like serenity to accept the things I cannot change, but the courage to change the things I can. And the thing that honestly I struggle with the most is the third part, which is the wisdom to know the difference, right?
Yeah.
Because I mean, that's a whole other thing. But the point is, again, this is why I think maybe even just helping relieve that stigma is like those are things I learned, like, from my sponsor. And then, but being able to then apply it in like a work environment, coaching has helped with. But it was easy for me to buy into that concept because I've already bought into it. I'm just now, I have like somebody who's more skilled to be able to help me apply it to my work because
Yeah.
that person's also a surgeon. Anyways, I guess I'll get back into like we'll go back into like, we're like doing deep dives and then going back to
Yeah.
the 1,000-foot view. But just
Mhm.
to summarize, at this point, I'm in my research time in residency. I've already gotten out of the hospital for my little psych episode, and I did my outpatient program. And so I signed a 3-year monitoring agreement with the Physician Health Services. That's the name of their PHP in Massachusetts. And then I had a psychiatrist who actually, fortuitously had played a big role in my life, especially a couple of years later. This was now, so we're talking like March of 2018. And so at this point, I'd accepted I was doing this monitoring. I don't know how much I accepted like me and recovery work. I was kind of like dabbling, and it was almost like I think I told myself at the time, I was like, okay, we just have to do this for 3 years. And then afterwards you can do whatever you want. And that's probably where my big
Mhm.
downfall was, right? I think is like thinking I could safely imbibe in any sort of mind altering substances ever again. But that was like that's the only, I did the best I could. And that's how I look at it now is that, um, you know, I need to take accountability, but it was also just I wasn't there yet. I wasn't ready. That's what, and I was doing things, checking boxes, white knuckling it because I wanted to get back into work. And I think I heard this from like, have you heard of Dak Shepard? He does that podcast, Armchair Expert.
I don't think
He's a
so.
comedian. He's married to Kristen Bell, I think, or something, but he's in recovery, and he's had some
Oh, yeah, I know who you're
he's very
talking about.
candid about his
Yeah.
some of his struggles, and he's had slip ups and relapses and all that stuff. And I don't know, one of the things he said really stuck with me though is the first thing that you prioritize over your recovery is the first thing that you lose when you relapse. And I mean,
Wow. Oh my
talk
God.
about like how that was
You gotta repeat that.
literally.
Oh my God, can you repeat that?
Yeah, yeah. So, and I might not have it word for word, but again, general gist of it is the first thing that you prioritize over your recovery is the first thing that you lose when you relapse. And so,
Wow,
obviously, for me, it
that's
was work.
profound. Mhm.
And unfortunately, I didn't. Not that I think hearing it back then would have probably changed anything because I still like, the acceptance part is such a powerful thing, honestly. Um, and the lack of it is a big, you know is just as powerful in a not good way. But my point is like, so that obviously work was my thing that I prioritized over my recovery, and recovery was like an extracurricular sort of thing. Now the recovery is number one because without that, I can't have work. I can't have my marriage, which was like, hanging on by a very, very delicate thread, and most only because my husband is incredibly forgiving. And, I mean, a lot of people would have left. So like, and even just the relationship with family, none of those things can happen unless I am a not even just so like free of substances, but like an emotionally sober individual, which means, that's what being recovery mean it is. And I was a relapse waiting to happen when I left residency. So I went back in full speed ahead in 2018 in June. At that point, I was clinical PGY4. Things, went well, and you leave your program and you feel like a rock star initially. At least that's how I felt. I had matched into a very competitive fellowship, hepatobiliary and pancreas surgery in the Midwest. Even that, like, I can see how I was making decisions again. It was like that old behavior was coming back, like because, and again, this is a fellowship, this is a specialty where there's only like 15, in any given year, it can be a little bit different because some programs don't accept a fellow every year. But like, I think when I did it, there's like 15 programs between the US and Canada. I interviewed at most of them, I would say. And it was really funny because I went to one place, it was a smaller place, not like a huge name recognition, down in Texas. And it was actually somebody who's also was fairly, like, they were very close colleagues with my program director. I think part of the reason picked that specialty was like just because I had such good mentors in that specialty. That's what my
Yeah.
program director did, and that's what Mark Callery, who's another really amazing surgeon at BI and a really good teacher. They make you love something,
Yep.
but honestly, I think that part of it was just my ego too,
Mhm.
because like how cool is it to be able to say you can do a Whipple or like a
Yeah.
vascular resection with a Whipple or a liver resection. I mean, there was a little bit of that, like again, the ego coming into play, being able to do operations that like as if being a surgeon isn't enough, like I have to be able to do those operations that most surgeons couldn't even do,
Yep. Yep.
general surgeons. Like, so that was definitely part of it. And it's only now I can recognize that. It's like how we, understanding more about what our values are. So anyways, but I remember again, going back to this one interview I had at this place in Texas. He always had a point of like in the interview, giving a piece of advice for every single interviewee he saw. He's like, I'd like to just, he was very into education. He's like, I try and mentor you guys, and I would just say like, and it's funny because like I was thinking, oh, like, I don't know, first of all, what's he gonna say? Like I have an awesome resume, whatever, right? I was so full of myself, but um
I love
he
it.
was he said, I look at your CV and I'm like, all I can say is like I see, but like what was scary is that he, had only known me for like whatever 3 hours and said something that like hit me to my core and was 100% true. That I was like, I cannot believe that he was able to figure that out. But he said, I see a person who is trying to hammer a square peg into a round hole. And I was like, who the hell is this guy? I was like, what are you talking about? Like, because, I had publications, but you could actually tell a lot of the stuff was very different. And he's like, I don't know how he figured this out either, but he's like, I see you in like education or doing something like that. And I was like, oh God, I look at my program director's like life and she's getting called from residents and like, because everybody trusts her. So they, you know, her, like, it just seemed like chaotic. Like I would never want that. Right now it's funny because I actually would really
Mm.
That's more of like truly what is important to me is like, the mentoring and the teaching and actually maybe doing it on a leadership level so I can be part of the positive change. Like she was for me. I don't think I ever had a negative like thinking, oh, I was too good for that. Because
Yeah.
first of all, you should know my mother is a teacher, so she would it's like
Yeah.
if I ever said that. But also like I think it was more like I just don't think I didn't think I had the aptitude or the whatever the personal attributes for it initially because I think I can be kind of impatient and I've as I've been sober, I've realized I've lightened up a lot on my like, kind of intensity level, but I have always held myself to a very high standard. And so as a result, that would mean I held other people to a very high standard. Perhaps I think especially in residency, maybe even to an unhealthy degree. Like I think I was better at it when I kind of came back for my fourth year and I was like, sort of at least introduced to recovery
Yeah.
and was not using substances. It was like, I mean, you're definitely clearer and I had a lot more empathy for people because, I mean, that was obviously a very traumatic experience for me. So I don't want to say that I was like, terrible the whole time, but I do think I could have been kinder to people and more, empathetic. And but the point is that yeah, like I never thought I was those things. So it's like, well, how could I possibly be like that? And actually that's probably really who I am. I just was out of alignment with that a
Yeah.
little bit.
Interesting. Yeah.
But anyways, it was funny because that's what he said, and I was like, at the time, I kind of took it as an insult, but like, and of course, I think I just said like, oh, thank you so much, like, yeah, it's gave me a lot to think about. But in my mind, I was like, screw this guy, like, the hell's
I love
no,
that line too. That gave me a lot to think about.
yeah, like I mean, I was fairly good at having a poker face, I think, or whatever, but like also being like, I Well, what's funny is like I was actually like would have been that would have been an amazing person to work under. Would have been very similar to like an Amy Vertrees or
Yeah.
Kent, who was my program director. Like, and I actually would have gotten an excellent experience, technically speaking. I mean, they were busy, but you know what? It didn't have like a nice little fancy name attached to it. And I think I let that influence my rank list a little bit. So, anyways, long story short is I matched in the Midwest. What I would want to say about it is that whatever I say after this in terms of my experience in fellowship, like I was telling somebody else, like not because I want to go back and do everything over again, but I would be curious as like a passive observer to see how it is now with like the mindset I have now. And I'm still not, so I talked about earlier when we recorded, like I'm still figuring a lot of stuff out. Don't get me wrong, like self-sabotaging behavior. But I also have like more self-respect, more self-compassion than I did. I'm definitely my self-esteem is much better. And I mean, obviously I have the clarity of not using substances and things like that. So I think like my overall feeling of self-worth is better. And so I just wonder what the things that I thought were like so horrible or whatever, like were they really like that?
Mm.
Like if I was being coached, like and I was talk about an
Mhm.
incident I had in the OR, it's like I feel like that would be a case where I would realize, oh, if I talked about the circumstance, do the thought model practice, right? Well, what makes you think that so and so did they actually call you an idiot? Or did they just, like stuff like that? Like I'm just
Mhm.
curious. Like, so that's why I actually am always careful with it because I really I and then this is also goes back to the recovery thing is I really had to do like a huge self inventory thing about my resentments and especially like what my part is in the things that eventually transpired. And I obviously that's important not to blame yourself, but to really just I get take ownership for what parts you do own. And also it gives you power to like basically move on. And so there's that and also ironically enough the same place that I had on my resentment list that I then realized what my part was. I mean maybe 3 or 4 months ago I reached out to my former program director and made an amends with them and they've actually been very gracious and been helping me with I needed some things from them for licensing and so I just look at it in a different way but when you go into it with one mindset, it's like it doesn't matter because you're just telling yourself a different story. And
Yeah.
so the story was I was getting, basically I was a relapse waiting to happen because I didn't have a good recovery foundation. I was just like little checking little boxes like, oh yeah, I went to this meeting, got nothing out of it. Like
Yeah.
um the one thing that saved my life, honestly, was that I was, obviously going to therapy still. And I kept my same psychiatrist that I had in Massachusetts when I moved because, at the time, so that was the other thing, by the way, like talk about, so I was probably burnt out, I'm sure. I refused to use the pandemic as a reason for any, like as an excuse for anything. But like the point is that I didn't unpack a lot of the messed up stuff. And that was at the period of time. So it was 2020. That was like year one.
Mhm.
We didn't know a lot of stuff about it. PPE was an issue. We were rotating, like we were doing all of these things so much differently than, like we didn't have the same experience. And some of it was good. Like, I had way more autonomy as a chief than I would have otherwise because of the way they structured, the services. Therapy was sort of like it was virtual, so you didn't have the same, you definitely didn't get the same thing out of it. And I just never really like unpacked that stuff. And then I go to this new place where again, when you go somewhere different, they may not see it yet that however you are, and I think that that's something I appreciate now. But so I think I don't know what I was expecting. I think I was expecting like the same level
Mhm.
of validation, first of all, which I was just too dependent on, and I didn't realize it. Like I took it for granted. And then when I
Yeah.
wasn't getting it, I didn't take it well. And then I didn't establish like a little network in Ohio. And I say Ohio specifically because I mean it's, obviously eventually I think it's important to mention that as far as some of the changes that state's made. But there were so many things where like I could have protected myself or like armored myself better. Um, even if it was like even a more toxic experience, I probably could have handled it for a year. And I just wasn't in a place where I could. So every little thing was like a personal attack on me and my abilities, and like every little like side glare or whatever, it's like you just kept internalizing it.
Yeah.
And then one night it was just like I just remember feeling like it wasn't like a panic attack, but just feeling like couldn't go to sleep, feeling of impending doom. I'm a terrible surgeon. What am I going to screw up tomorrow? These are surgeries I used to literally go skipping to the OR for because I was so excited to do them, and now I'm like, I don't want to go into work the next day. And it was very disturbing to me because I have really so much joy for, being a surgeon. And that was, it was almost like I like was a shell of my even former self and certainly currently. So at some point, you quietly, when you don't have a good recovery program, you turn to old tricks. And
Yeah.
I started using wine to cope with those feelings. And I always had this like line in the sand I would draw, like I'm never gonna do it at work or obviously go to work impaired or like those were
Yeah.
like bad people to me, right? Like, and now I recognize even those people, like it's just that's what that disease does to you. Now, I was in a monitoring program, so eventually it got found out on a urine test, and I wasn't drinking at work and I wasn't impaired at work, and there weren't any allegations of any of those things. Unfortunately, I guess you could say unfortunately, maybe fortunately too, like I was in a state that was very, at the time, punitive for physicians. So they basically had this rule where like you were allowed to be in a monitoring program and be kind of separate from the board, but if you had like one relapse or one slip, you're considered, and they didn't distinguish between work involvement or not. Like maybe they would for like the amount of time they would suspend you, but like all of them are considered impaired physicians if you relapse. And so impaired physician needs discipline. So I was looking at an automatic license
This
suspension.
is horrible. This is so
Well, yeah,
horrible. Just because, okay, so back just a moment. Sorry, I know I keep wanting to deep dive because
yeah,
I just
yeah.
think
It's
these are
okay.
such, this is where things are wrong in the system, right? We're,
Agreed.
we have humans, physicians are humans. And when you are saying you used to skip to the OR and now you're not, as like a friend, I would say, I'm observing a shift in behavior. I'm wondering what's going on here. Are you okay? Right? With compassion, with how can I help you? What's going on? What does the board do? Well, of course, returning to that substance that was there to help with those emotions, that's part of your coping strategy. But rather than be that best friend, they're going to judge you and say it's something criminal. Like, it's not
Well,
criminal.
yeah. And I think the thing is to understand, like, to separate out the board is not your friend. right? Because, and these are, the board is not the same as the physician health program. They are separate entities for the most part, but the physician health programs have an obligation contractually to report to the board for issues of quote unquote non-compliance. Now, what I will say is that their discretion that they're able to use in terms of reporting is oftentimes out of their control. It's directly dependent on what the board allows them to do. Because if they, obviously the thing would be like worrying about hiding doctors who are unsafe. And if the board,
Yeah.
then that would totally just destroy the trusting relationship. And then there would be no like confidentiality for anybody. But the
Mm,
point is, and this is important to bring up because actually, Ohio is an instance of a state that's actually changed their stance on this, and I think this is an important thing for us to talk about though, because we get into a lot of the thing about the licensing questions, and don't get me wrong, like those are like that's an amazing first step, but that can't be okay. Victory, we don't have, that's it. That's like sort of the gateway, and then like there's other things that need to be worked on, and I think the big thing is that will help people who are like maybe lower risk that want to get treatment safely, but people are still not going to get treatment, especially with a PHP, which actually provides you a lot of helpful resources if they know that like they have one slip and they're screwed.
mhm.
Um, Addiction, whether it's alcohol or anorexia or anything, is a chronic disease, and it's one that relapse is a part of it. It doesn't have to be for everybody. There has to be some grace given to get not harming people or things like that. But like the point is that I'm trying to get back to is that the board doesn't care. And I don't mean this in a cynical way. Again, the board being the medical boards, their first priority or their main priority is to protect the public. And so if there's some collateral damage physician wise, then they're going to err on the side of, as a surgeon, like err on the side of being conservative. They're going to err on the side of being conservative in protecting the patients. Now,
I'll say how flawed it is though, because as you kind of pointed out, and when I was thinking about the military
mhm,
and where you're at, right? You just said how many tools that you have now because you went into recovery, like you went into all of these
yeah,
services. Whereas if people are afraid of the repercussions, a lot of times people don't seek help, as you were saying. And then those people have less tools because
yeah,
they're going under the radar. And those, it not only, it's a more of a risk. And I want to focus on the risk to the actual person because, we know that you weren't drinking at work and they could see like, did she do anything that could have risked like harm the patients and had a real plan that was individualistic. But
yeah.
I fear like I knew in the military, I counseled a lot of people, and there's a lot of data on people that don't report things because they're afraid of retaliation. They're afraid of the impact on their career. They're afraid that if they speak up, then things aren't going to get better for them. It's just going to get worse.
Mhm.
And so this conservative, quote unquote, is actually not conservative for the lives that are being impacted by not reporting and not feeling comfortable to
Yeah.
speak
And I
out.
think I kind of have to look at this with like two different lenses. Like, so when I put my recovery hat on, I know that stuff needed to happen for me to get my quote unquote shit together or like finally realize, yeah, I had my light bulb moment slash rock bottom and that was it. So like I'm able to put that right size that situation and make, realize that for me, I needed to get derailed somehow. And by the way, that rationale that you just explained is exactly putting my human doctor clinical hat on, not somebody with a skin in the game for addiction, I guess. It's a simplistic way of putting it because we all really do. But like, point is like separating myself from it for a second. Yes, we know that basically, first of all, there's plenty of evidence out there that impending board action or fear of board action, or investigations are a risk factor for suicide. I mean, um, obviously, that's a complex, multifactorial tragedy, but that is definitely like, I mean, you can't say that doesn't play into it a little bit, like, especially when you're talking about someone's livelihood or their calling or
Mhm.
all of that stuff. So that is one thing, but I 100% agree. I mean, because I even just, if I think about myself, like using the mentality of, well, if if I have to, even just like looking at the license questions, if I say yes to this, they're going to ask me more questions and they're not going to give me my license. And so like, I'm not going to get I'm not going to get help then. That's why you hear about doctors that go use aliases and get, pay cash, and like they just don't ever want to know. And that part is changing, obviously, for the better. I think Lorna Breen Foundation has been a
Yeah.
big, and I'm actually involved with them as like an ambassador, which has been really rewarding. But like point is like, change is starting when you're dealing with systemic change and multiple systems. Like it's obviously slow, but they've actually, they've accomplished a lot when it comes to questions. Now, the whole thing of, yeah, the treatment, I think, so there's a national, just like there is for like, American College of Surgeons, it's called the Federation for State Physician Health Programs, or the FSPHP. It's like the national organization that like all of the state PHPs operate under, so to speak. And I think they put out like, I don't know if it's a white paper or like, guidelines or something, but it was about dealing with like impairment. And they basically classified like there's different levels of relapsing, and what they're saying is that as long as like it can be safely done, taking a physician out of practice, getting them more intensive treatment than they received the first time around, or basically like treatment oriented decision making, not like discipline is not treatment. Like anybody who knows,
Yeah.
like you get hit or something, that doesn't make you be better at, like
Yeah.
it's standard psychology, like the whole, positive and negative conditioning.
Mhm.
So, like, if they're not harming anybody, then why do we need to, like, we can take them out of practice. And so, like, I guess that's where I'm getting to is like whether I would have had that same mind shift, I'll never know because that's not how it happened. But like, whether somebody said, okay, you basically agree to not practice, that doesn't have to get reported to anybody. And then if you refuse to go to treatment, which is, never did this, I immediately was like, finally. Like I got caught in a way. Like I was just like,
Yeah.
I'm so tired. I just wanted, yeah, you know what? This actually sounds really nice right now.
Yeah.
Like just
Mhm.
escape, if anything else. But point is like, you agree to do the treatment, then, and this is how it is in a lot of states now. Like they don't even have to necessarily report it. If you refuse, then they do. And that makes sense, right? I mean, like, because even if you're not harming patients yet, we all know how this disease works. You're
Yeah.
going to eventually, I would have crossed that line eventually. And that's why for me, that had to happen. I think it was like maybe 6 months ago. Ohio actually did recognize that they for all the reasons we just talked about, that maybe that's not necessary, and that will actually be more likely to have physicians seeking help if they know that not only like the actual seeking of the help isn't going to hurt them, but give them some room to fall a little bit, stumble a little bit, as long as it's being done safely. Like, because if you think about it, I don't know, like even if you're looking at it from like a public safety standpoint, like yes, I ended up having a relapse, but in some ways, like that program worked perfectly because it caught it so early that I hadn't even crossed any lines yet, and that's sort of, I think, the rationale for monitoring, especially early
Yeah.
on. So they changed their rules. And the thing is that anytime a medical board changes their policies, like especially big ones like that, they have to get approval from the governor. And that was why it was punitive at first, is like the governor who was there like a decade ago felt like there were too many scary doctors out there. And so now we need to be harsh. And then, like, yeah, you have to get all these like special approvals from like state congressmen to actually change like state laws first before the board can change. Now, interestingly enough, 3 years after, so I've been sober for 3 years. The state I did my residency in is actually coming after me for the fact that I was disciplined in Ohio. There's like this thing called reciprocal. So there was lots of collateral consequences that happened that, thank God I didn't know about all of them when I first relapsed. That sort of trickled in because who knows, maybe things would have been differently. But like, yeah, there's a reciprocal thing where they're trying to prevent like the doctor deaths, so to speak, right? Like the doctors who would be dangerous and get suspended in one state and just move states and practice again.
Mm.
But again, the problem is, as you alluded to, it's kind of lazy. You're just basically taking a one size fits all approach to everybody. And I don't think you can take my case and say, oh, yeah, you're the same person as like the doctor who was like sexually assaulting patients in another state. Like
Yeah.
that's a little different, but so that's one thing I think that clearly can change, because I assume if that state is, disciplining me for something that's no longer disciplinable in the state I was disciplined in, that they must also feel that way still. And when you look at like, say Pamela Wibles got that whole list of like the states that are good for mental health or whatever, which, may be updated now by somebody else, like the Lorna Breen group. It really just talks about like mental health, like separate from substance use. And actually, many of the states that are known for being good mental health states may not be good for doctors who have their mental health disorder that happens to be a substance use mental health disorder.
That
So,
is very
right.
interesting to me because
I mean,
I wouldn't
Massachusetts is a great
separate.
example of that. I mean, they
Would
really are, because they don't
Yeah,
have like positive press for like, having the statewide changing up their credentialing things. They've changed their state applications, licensing for, but as soon as you get into the tentacles a little bit, if you have a problem, then that's why I like to focus a lot more on of my advocacy stuff on, I guess selfishly, stuff where, okay, like what if you did have a problem though, and like, trying to avoid like unnecessary punishment for people, because it's
yeah.
a huge driver of people leaving medicine altogether. I mean, it was a huge driver for me thinking about leaving medicine like several different times. And I mean, fortunately, I found some, and then it obviously drives like employers to discriminate against you too, because it's not like an ADA problem anymore. If you have a license action on your thing, they can just use that as the reason. It's so it can be really harmful to your career, and it doesn't necessarily have to be if you're not harming people.
Yeah, I think you're drawing awareness.
Um,
It's really great discussion that you're having too. It's just drawing the awareness to the different philosophies and trying to identify what is appropriate. Like, how can we modify this? And that, like you said, it is catching people early in a way that's supportive of their recovery journey, of their healing journey, using different language and keeping the end goals in mind of patient safety. And like you said, not, I think the discriminatory aspect of it and with this doctor death or people who are doing very illegal things, I think the individualistic approach, like, what is this? Your lived experience is so important. Your voice is so important in that matter.
Thank you.
Mhm. There's going to be many people at different stages in their career who are navigating mental health, getting help, and the recovery
Yeah.
journey. And as an earlier career physician, I'm really glad to hear your voice because I'm also earlier career and I lost my surgery career when I got mental health support. And I think that people who are in vulnerable positions are afraid. And I would love to
Yeah.
kind of have you speak to those people who are, I'm early career, I'm afraid to speak up.
Yeah, I mean, I think that ultimately nothing is like, more important than your life, first of all. So that's where things for me got really dark, when I had finally gotten caught, with the urine test. And then I was, pretending to go to work for a week because I was too terrified to tell my husband, who already knew I was drinking, because that was deteriorating our marriage way before, I got in trouble for it. He was hanging on by like a thread, but I was still terrified to tell him I got caught. And then I had the whole thing where I found out I got terminated from the fellowship, which was a fairly impersonal experience, getting an email from a GME officer on a Friday afternoon. But long story short is that was certainly like the dark day I had, where I had contemplated suicide, and my psychiatrist basically saved my life. I mean, he was the one person I've been talking to that whole week. One thing I would say is that if you're lucky enough to already be seeing somebody, keep a relationship with that person, not because you're trying to like say, you're planning for the worst. Expect the best, don't assume you're gonna
Yeah.
fail, whether it's, addiction or any kind of mental health stuff. Like, I think it's so important continuity wise, you keep that in place even when things are going well, because no one's going to get help once they're not going well, because that's whole part of the whole just destructive
Hmm.
cyclical thing is rationale goes out the window. You don't, and then there's the whole helplessness thing of like, like this isn't going to help now. But if you have it already in place, and he was actually like, now I talked to him about this like last week or something, and I was like, I just want you to know, like, I don't think I appreciated this at the time, because you're so casual. I don't mean this in like a unprofessional way, but just like, he kind of like keeps me at ease. So he's not like, having me sit on a couch. He's just like a normal, like he just talks to me like a normal person, basically. And he's obviously got his little psych tricks, but like I never really felt like I was getting, brainwashed or anything. And but no, it was funny because like I actually realized that he was being really skillful, because he would call me, and again, I actually felt comfortable before I even told anybody else. I told him what happened, and I was like, look, yeah, like the jig is up, like I know I want to get help, but I was obviously terrified about, and I didn't know everything that was going to happen yet. I did know that I was most likely going to have to sign an agreement to suspend my license and all that, but I didn't know I was going to get fired for sure. And anyways, every day he would be like, "So did you talk to Ian?" And I was like, nope." And if he had said, tried to lecture me or like sort of, or feel like if I ever felt like he was going to like force me to try and talk to him, I would have never picked up the phone the next day when he called. But he didn't. He would just say, he would sort of do the psych thing, like, "Oh, why do you feel like you can't talk to him?" Or blah, 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 like something, fairly benign,
Yeah.
and like maybe he'll surprise you, like, and I'd be like, "No, not today." And he's like, "Well, maybe you'll talk to him tomorrow," And then it was like, "Okay, well then I'll pick up the phone when the psychiatrist calls me." So then by the time this had gone on for long enough and I was somewhere dark, um, I called the psychiatrist while I, saying obviously the most recent thing that had happened, which was the termination and me being like, everything's over. I mean, I really did. Like, when you are in that dark place, and I guess I'm talking to this person now, like I get it, all rationale goes out the window. You cannot see the forest from the trees, and your whole identity is most likely wrapped up in being a doctor or surgeon or whatever your, occupation is. So you're assuming that it's over. Um, it's probably not. And even if it is, you're really smart and you're going to figure something out. Like nothing, anything that is like by definition, like I think Carrie Cunningham said this in her talk, like anything that can be taken away from you is by definition not part of you, like your identity, or like is not you. Like I do consider surgery or being a doctor a calling, like I think that's how I can tolerate some of the screen is, but if I just strip it down to like, okay, my why, and yeah, I mean, I do think it's a little bit of a higher calling than like I don't think of it as just a job because I also love it. Like, and I feel like it is, I have a purpose and I can help people, but I'm also smart and I can do other things if I wanted to. Like I would still even today, like if I had this like whole existential thing, I guess this will get to my second lesson, is that obviously I'm here, so I didn't pursue the harming myself, thankfully. And my psychiatrist calls my husband, and my husband basically like just kept saying I love you over and over again. Like it was like I was thinking of all these things that I had done and, ruined both of our lives. And it was like he was just basically telling me, not that he didn't care, but it's like, I love you, not
Mm,
Dr. Courtney or whatever,
mm,
So like that kind of snapped me out of it. It was still kind of a rough few days, but I like was definitely like sort of in the crisis mode was out at least. And when I left treatment, I had like this new set of glasses because nothing had really changed externally. Like I still was no longer employed. I knew I couldn't practice medicine for I think I got suspended for like 90 days. But then, you have to I just basically started focusing on my recovery and I like dove into it and I think what was different this time is that I actually believed it. It wasn't like I was just like intellectualizing stuff. So I think
yeah.
like you really just have to want it. Even though I mean, I guess like this is the perfect example of why sometimes like even just having a leverage like a holding your license over you isn't enough if you don't really want it. Like,
Yeah.
you can't force anybody to do anything because in my mind I still somewhat had a choice. And
And like you were saying earlier, actually trying to force somebody, people can have the opposite reaction where they're like, if you're going to try to force me to recover, I'm going to not like they may not
yeah, it's
notice.
almost like I like and I don't, I used to say that was like that maybe I was just doing it because I didn't like to be told what I want to do. And it was almost like holding me back from just accepting it too. So like, you do have to do that internal work. And that's like what I did differently the second time around. Well, like I guess I just took it seriously, first of all. But honestly, once I started going to like meetings and thinking about the things that I had in common with people instead of what I had different with them, I think was a huge thing. And then having a sponsor, which I never did the first time around. She's the most patient, wonderful person I know, or one of them at least. And I still have a very close relationship with her today. So like, that first year can be challenging, but the things that you do now in your recovery is like basically like working on how to deal with life on life's terms. It doesn't even really anymore have to do I mean, I'm not saying like I would never think like, you have a thought every now and then, but it's not like you're white knuckling it. Like
Yeah.
I rarely ever think about it actually, at least in a good way. Like, and even that's even, I've been able to weather some storms after this. So I guess, that would be my thing is, when, and this is whether you have a suspension or even if you're just taking a sabbatical, like a mental health break, use that time wisely. Like, obviously, self care is important, but then also, the other thing I did was I really thought about, and this was part of like my internal growth, which went with the recovery stuff, was understanding what my values are and like why did I make decisions before, like, and then I started having a little bit of a crisis because I was like, well, was it just the subspecialty I did that kind of like, was misaligned, or like, oh my gosh, did I like become a surgeon and I should have ever, then I started getting really overwhelmed. I was like, oh my gosh, like all these
Mhm.
decisions I made, like where did I veer off from like my true path? And I remember, and my sponsor's not even a physician, but I like was telling her all this stuff, and she's like, "Well, I mean, is there some rule where if you go back, you're not allowed to leave again, like the mafia or something?" I was like,
Mhm.
"No." She's like, "Well, I mean, what's the harm then in try, like if you, it's one thing, by the way, I'll say if you were not sure, or I mean, if you were sure, like it is not for you, then you're doing yourself and everybody else who you could help in the future a disservice by staying." I just was like on the fence and being like, I don't know, like, and
Yeah.
like I also wanted to make sure I wasn't running from something.
Mhm.
Like, and I felt like for me, because I still think that there were reasons I went into surgery that were true to me, not like ego related.
Yeah.
For me, I was like, I would have always wondered if I didn't try it. And sure
Yeah.
enough, even before I even went back, I was like talking to some friends from residency and they were talking about some case and I was like already in like my like
Mhm.
this is fun mode, collaborative, like, I was like, oh man, yeah, I still have the itch. I have to, I owe it to myself to try. But like I was alluding to earlier, if at some point I realized like, I'm miserable and I can't do this, as long as I'm doing it with like a clear mind and I've done all of the mental work and it's not like something that's like you're doing it out of reactive nature, then I would do something else. But I guess that's the point, is that we can do, this might just be, and this is also, I think for me, the thing that's helped me a lot is like, this was always meant to happen this way. I don't know why
Yeah.
I like that way better than like, I hate the everything happens for a reason, but like, like if something happens, I've been able to now see, like I've come full circle with all this, that um, I am exactly where I'm supposed to be right now. And it took me a while to figure that out, like, but I think just give yourself a little grace and compassion and ask for help, especially, like I've said before, everybody has at least one person, hopefully more than that, but that loves them for them, not because of what they do. I would say reach out to them because you'll probably realize, realize that they just, they snap you out of it when you need it. And you'll eventually realize maybe why certain things had to happen. And then the other thing I would say is just, have a good narrative about it. I obviously have to talk about this a lot in every application or interview I've had for a job, and just stick to the facts and then how that changed you and where you are now. Try to avoid even if it's true, like this gets into coaching again, right? Like what was unfair or getting mistreated, because even if those things were true, those still, like to a potential employer, make you sound like you're blaming,
Yeah. Mhm.
and I think in general, the feedback I've always gotten is like, that you just own it and recognize, like, what you're doing now. That's honestly more important. They want to see how that experience, how you've learned from it and how it makes you better. And so when I talk to people, I say, well, look, like I maybe spend a few seconds on like what happened, maybe a little longer. So I'm a talker, obviously. But
I'm enjoying this, but I think this is a good
yeah,
point too about your sharing here is very informative and sharing in more succinct manner for the people that on the
yeah,
need to know basis, because a trauma response is to explain it, right? And to want to explain it more
right.
to the people. Or something that I heard you say on Amy's podcast and that I would relate to is when you apply to something like, I'm going to put my skeletons up front so that I'm not worried that they're going to hire me and then find it out and then I'm not going to, so Like,
Yeah.
learning that, like, what's appropriate, and I love what you just said, is showcasing it, and here's what happened, here's what I learned from it, and here's how it makes me better suited for the position I'm applying for.
Right. Because I mean, the end of the day, I am more empathetic physician. I listen more. First of all, I just have a general appreciation for my job so much more because I was so close to losing it. And I know I'm in it for the right reasons now. I also accomplished a lot when I was not very well. And so now I have this like clarity of mind. It's like, just imagine what I can accomplish now. Like, I mean,
Yeah.
but the point is, yeah, like how we're talking about it here is not how I would say it to like a potential employer. And so, and don't, you have to practice it obviously a lot, but get a couple of different set of ears on it. So like, actually a good example of this is like when I was moving to New Hampshire, I spoke to, Molly Rosignol, who's the director of the PHP here, because I knew I was going to have to, transfer my agreements over and all that. So I'm still in monitoring for another 2 years now. I mean, at the time it was like 3.5. She actually looked at my questions that I did for the license, like the state license application. She's like, "Oh, you don't need to have a lawyer look at this," like, which is actually nice. It saves you some money. She looked it over, and at that time, I think so. I was still obviously I've had a lot of growth since then, but I was still fairly angry, I think, about what happened, and I felt like I needed to explain why did I have this relapse, for example. Like I thought that was important for some reason. Like you don't have to worry about this happening again because I'm going to go into a different environment, but they don't care. That's actually what she said to me. Is, like no, this is mostly good, but honestly, I would just drop the part about the toxic environment and stuff. Like nobody cares. Just say what happened. Say,
Yeah.
say what treatment you got and say, why are you better now? And I was, first I was kind of like, oh, that was kind of mean, but she was right. I
The
don't think I could
toxic
done,
environment part is where you vent to your friends about that, and what was
right.
toxic,
Yeah.
and
And I
then
think in
you
my
vent to your
mind though,
friends.
what
Yeah.
happens, like I sort of like knew you don't want to do it like that, but for some reason I thought it was important that they knew why, that
Yeah,
I was
I
going to be just some
definitely
like
get it.
unpredictable, like, oh, she's just going to pick up whenever she wants. But
Yeah.
it doesn't matter. Like what I was able to distill was like, why am I different now than I was then? And we just hopefully at some point in my random rants figured that out, is that I just actually embraced recovery and realized like the strengths that it gives me. And probably at the time I did that application, I hadn't done like my quote unquote step 4 and 5 yet, which is where I realized what my part in all of that
Yeah.
was. They just gave me a license. Like I didn't even have to. It was like I got a license anywhere else before all this happened. Like I was kind of expecting I was going to have to go in front of them, but I had already done all the pre-work. I already had an agreement in place. Like it was already obvious to them. And this is why, like, and I appreciate this state very much because they are reasonable individuals. They don't like it is their job to protect the public. The public's protected. She's getting monitored. Why do we need to make this more difficult for her?
Yeah.
Like obviously, she's a good doctor and so like and I had already arranged to be monitored by the PHP here before I even submitted my application. And I'm doing the same thing in Tennessee now. That's my point about your narrative being
Yeah.
important and try and have it succinct. I'm not going to lie, try and misrepresent and say I was always succinct in every single thing. I think it's important to bring it up early. I got really lucky with well, I don't know if you say lucky with my first job, but I led with it and they like loved me for it. But I actually have since realized that shouldn't be the thing you lead with. That was sort of like almost like an aberration.
Yeah.
So
And
you like
it
talk about your
depends,
feelings,
right?
right?
I think there's always a purpose to have, like, I wonder why that felt important for me to lead that way, right? That's the curious.
Yeah, it's funny because yeah, like I mean, I guess I don't know why. Obviously we eventually got into all of like my qualifications and stuff. It's not like they hired me just because of that.
Yeah.
But yeah, like point is, I would try and if you can get it in the first thing, but then again, I guess I learned the hard way is that maybe that didn't work for everybody because when I had to find, I got laid off about 10 months into my practice in my first job, which was devastating and why I related so much to that episode you did with Stephen Llewellyn. I mean, it was a very similar thing for me where somebody just came, the admins come into my office as I finished clinic. I hadn't even finished typing my last note yet. And they're like, oh, we'll finish that. And I'm like, well, like, I can't just like finish this now that you're like standing here. I honestly, and again, obviously that it was like a same sort of thing. Like you leave that day and they'll, they pay you out for your 90-day notice. But like you don't stay for like you literally leave that night or
That's
day.
crazy. That's crazy.
And that was devastating. I mean, so then I had to deal with the whole job search thing again. And I realized, like, I remember my partner had said, "Oh, you're going to be fine. Like, you're going to have a job within 2 or 3 months tops. You're this much further removed from that Ohio thing. You've got like almost a year now under your belt, practice wise. Easy, you'll be fine." And I wasn't. I mean, I think I applied to like maybe 10 or 11 jobs. I tried to stay in New England at first because we had just purchased a home. Wouldn't recommend that either, but we were just like, you rent for so long. It's like, oh my
Yeah.
gosh, finally. Like I knew I wanted to stay in New England. This is home. And I thought, like, okay, worst case scenario, there's plenty of hospitals around here, and I tried all, like any of the ones that were hiring. My background may have not, been a factor in all of them. Like, it's sort of a perfect storm of being an early career doc where they're looking for somebody who's got 5 years of experience and you only have one. Maybe it was a combination of the two for some places, or there was one place that literally disqualified me because of having had an action in another state, regardless of what I was doing now. That's just like their outdated medical staff policies. So that was really tough. I mean, I'm not saying I didn't pick up over it though. That's like the best thing is that like I was able to, maybe not every day I dealt with it productively and I had my good days and my bad days, but like I never felt even the need. Like I always knew I was like, there's no problem I have that's too big that it can't be made a little bit worse if I start drinking again, right? It's
Mm.
just that, you put that in perspective. But I had a lot of help. I
Wow.
mean, the PHP director was like the first person I called after my husband, sobbing, not because I had to felt a need to report. I was like for support. She was very supportive. So I had a lot of help, but then it was just, I mean, it took a long time, and obviously, I tried doing things I could control. Like I couldn't control, obviously the way, whatever policies they had, or for whatever reason why I was disqualified, but in parallel to this was having problems with my oral boards, which was frustrating because I wasn't something that I even, it was always testing something I thought I was good at. So that was hard. But I eventually passed my boards in October. And I was like, okay, well, like now I'm certified. And then
Yeah.
even then I was still hitting a lot of barriers. And I was like, okay, well, like I guess I'll try this whole coaching thing, even though I think that for at the time I was like, oh, I can't afford it. But you figure out like, first of all, I do have an emergency savings. It is starting to get lower, but luckily now I have a job soon, so I'll be able to pay myself back. But like I decided to do one thing, which was invest in myself. And it just so happened serendipitously that I did it because I had been listening to Amy's podcast for a while, like years. And then she just so happened to have this, 90-day notice course which they were actually gearing towards both people who were trying to leave a toxic job, but then also had recognized this trend of like it made me feel like, okay, I'm not alone. Like, oh, all of these doctors are getting laid off. I'm not effective. Like, okay, like even just knowing that like made me feel better. Then I was like, I should just try this. And then I did, and I wasn't, the outcome was far beyond what I would have expected. But like even if so basically, like the long story short is I went to the webinar that was free first.
I believe that's where I met you.
So
Right?
funny, I didn't realize.
Yeah.
Oh, because the webinar you can't really see who else is on it
Yeah.
unless they ask a question.
Yeah.
But I probably did. I think I did it anonymously at first,
Mm.
and then I was like, oh, maybe I'll just. I was like, then somebody had said something. They were like, oh, and by the way, and you can stay anonymous or blah blah blah. And I was like, maybe I should just say who. I don't know why I said my name, but I did. And then, and again, it was just like asking the question about, I was trying to get a sense of like what the course is really about. And also like, I knew I wanted to do coaching, but as you know, there's like different niches for each coach. So I wanted to make sure I was in the right kind of path. And then of course I didn't expect that the coach was going to offer me a job, which is what happened. So that was just awesome. But I mean, the point is like, I still do coaching. Um, and that is a huge help. It is like an investment, but you're investing in yourself. If you believe in yourself, that's the surest investment you probably can make, right? I mean,
Or if you don't believe in
so-
yourself, then you may really want to invest in your right? Because if you
right.
don't believe in yourself, I invested in coaching when I hit my rock bottom and thought like if I was desperate because I didn't believe in myself and the way I afforded the mindset shift of
Hmm.
scarcity and like I'm going to pay for this is like if I don't do this, I know where this leads, right? It's just going to be this repetitive cycle where I may not be here. So it's,
Yeah.
there's so many different, and not to say that it's like, of course I was, in therapy as well, but I find that, with what you're saying, everything that you've overcome and all the learning opportunities that you've had along the way and that you've really leaned into those and now investing is like, I think oftentimes when we feel that like, wow, I learned a lot, I finally figured out that asking for help was actually helpful. Right. And
Yeah.
I'm
And
wondering if
like,
that maybe inched your way forward to taking on an opportunity that's like, I'm going to surround myself with a community.
yeah, no, exactly. And it's like, how did I not think of this sooner? Like, I know
Mhm.
I'm already being mean to myself, but like, like obviously like the huge game changer. And it doesn't honestly matter. I'm not trying to be like a whatever preacher for any particular recovery program. But the point is, I was in a program that fosters community. Like that's why you don't feel like such an asshole for being
Mhm.
an alcoholic, like because you're surrounded by them and they've
Yeah.
probably worse than you, like and we joke about it. Like we can
Yeah.
laugh at ourselves, not in a self-deprecating way, but just like you gotta sometimes. How would I not like,
Yeah.
just bring some levity to it. But like, point is, I have so much benefit from that community. And it was like, oh wow. Like, I guess I just I'm point is, yeah, surrounding yourself with community. It's like not only just like the not feeling alone thing, even if that she wasn't looking for a third partner or whatever it was, the skills I got from that course, which are ongoing, is first of all being able to process like the negative emotions of like the layoff, because that is just such a, I mean, it's devastating. I mean, I and I can still look back and be like, okay, well, like clearly that wasn't going to be like the job for me, like long term. It was a good first job, but it was like already starting to like kind of lose its shine. And I think for me, it was just like, but I need to be working. Like, why is no one hiring me? Like, this is crazy. I'm well trained. I know I'm a good doctor. Like, I have very satisfied patients, the ones who actually have spoken up. And I feel like I've had this like adversity that maybe it was initially self-induced, but I overcame it and I am better for it. So like, anyways, but the point is that they help you with all of that stuff so that you don't, when you have your next opportunity, bring that kind of baggage into it and maybe show up as like less than what you're let your best self. Then finally it's like looking into what you actually want. Like I don't remember when I ever asked that before.
Yeah. Mm.
And then, finding your leverage and being able to articulate. Like there's so many things of it that were so amazing. And I think because like they're a great duo too, her and Amanda Hill. It just, I mean, it would like be fun, but like clearly it's like you've got a healthcare attorney right there. Like I could ask her, I mean, she's in Texas, but like a lot of the principles are still
Yeah.
similar. It's amazing having like the two people. I don't think there's anything like that out there.
I think
Um,
that's why they created it, right? Because there
They
isn't.
created it like that, but like
Yeah.
I still feel like because I was in the first group of they didn't have this course like they literally it would have been great if they had a course when I initially got laid off. I mean, it doesn't matter. It's like we're here now, but like when I was the first group, so we basically are like life members or something. I forget what they call it, lifetimers or something like that. So like I can go back whenever I want. I don't have to like repay and stuff. So like I'll go back every now and then because some days maybe I was more attentive than others, or maybe some days just like something new happened and I need to process it. It's like, just having that's why there's the whole continuous coaching thing is helpful.
Yeah.
The point is like it's fairly small and I'm like, there's way more people out here that need this course. So I mean, I'm gonna
Yeah.
just shamelessly talk
We're
about
gonna, what
how
is
it's
it the
helpful.
90-day notice or what is it's
Yeah,
the
90-day
sorry,
notice it's
90
called.
day notice. I'm
And I
gonna
think
make sure.
like I forget if it's on Amy's website. I think it might be on Amy's website, but Guard My Practice, which is Amanda Hill's
Yep.
business, is definitely on there. Like that most of our like modules or whatever are through like Guard My Practice. So yeah, I think if you went to Guard My Practice or you just reached out to either Amy or Amanda on their various social media channels, I'm
Yeah.
sure you can, there's multiple ways to skin a cat.
I will make sure to share all of their links down below. But before, you had so many takeaways at the end here, I just want to see, is there anything else, any words of wisdom you'd like to leave the audience with today?
Enjoy the process a little bit more, if that makes sense. Like, sometimes you are going to wind up somewhere that like, I used to be so into these like 5-year, 10-year plan things. And like, then it just sort of sets you up for like then being disappointed.
Yeah.
I'm much more like, just practicing gratitude and like understanding that like, uh, if you get a lot, I guess this would be the big advice point. Making sure like you are aligned, like your core values are aligned with what you do for work. What you do for work doesn't have to be our identity. In fact, I'm enjoying lots of things outside of work now that I never used to. Because honestly, I think sometimes career dissatisfaction, especially in medicine, because of how much sacrifice it requires, is like if you're not aligned truly with like what's important to you, not that that's like the single cause, but like it's obviously that would be a huge issue, right? I mean, can you imagine like having spent all those years and money and all of that if like you're just doing well,
I can
no, but
imagine it. I
you figure it out
did it.
eventually. I mean, but that's the whole point, right? Like, and
Yeah.
it's true to you.
It might, yeah.
Um,
It's so funny. I mean, that's why the channel's called A Life True to You. It's from my hard-earned way of experiencing what it feels like to live a
I
life
mean,
completely out of alignment. My
but you're
yes.
just like, but that's, and again, and I just always appreciate you being so authentic about it because you'll still talk sometimes about like, oh, well, sometimes I think there was something maybe you posted, you're like, I'll still walk by an OR and feel like, did I make the right decision?
Yeah, I still
That's
do.
like
I just did
human,
it a couple weeks
it's
ago.
human.
Yeah.
And only you know the answer, obviously, as to like whether it was the right decision or not, as long as you're true to yourself. But like, yeah, it's even if it was the right decision, like there's still times you're just like, but was it? Or
It
maybe you,
was the right decision at the time, but we have a
yeah,
lens that's just like you were saying about your
yeah.
fellowship. Like actually went back to my residency in October of 2023 recently, and I sat in front of my program director and he said, "You'd be doing yourself a disservice if you came back into dentistry. You need to pursue psychiatry." Because that's what I was in love with. I was in love with fixing the mental health um, sector, Western mental health, because inpatient for anorexia, I was like, this is, they don't know what anorexia is, like, and also not only for anorexia, but for bringing the humans back into the healthcare system and realizing that residents are being told, when I went to we had a taking care of your own program, and when
Mhm.
went and got mental health support, it was like, "Oh, but we won't tell anybody." And I'm like, "Great." And that made me feel a lot of shame because I was like, "Oh, like, should I not be here talking about my problems?" And I minimized my problems even with my own therapist. And I realized
Yeah,
we
me
just
too.
need, yeah, we need to be able, I mean, even to myself, it's not to be deceptive. It's like, because I
Right.
just,
Oh,
you've been
exactly.
saying during this conversation, it's like your mind allows you to accept what it's ready to accept. And those therapists will inch us forward. But yeah, having my former program director say that, like, because yeah, sure, could have been a great surgeon, could be a great psychiatrist, right? Like, what feels most in alignment with your values and also allows you to be well. Like,
Yeah, exactly. No, and I actually, it's funny, for a different reason, but like when I was having, after the layoff and I'm trying to find this new job and I'm like hitting rejection after rejection, I guess, what is different between now and like 3 years ago when I was, feeling like because, at that time I didn't know if I was going to ever get a job again, and I was like, well, if I can't do this, I don't think I would be quite as happy, but I'd be just, happy enough doing addiction medicine. That would have been
yeah,
my plan B. And I would have gotten plenty of satisfaction out of that. Clearly, I'm probably overqualified for that field now, right? I mean, it's honestly true. It's like not like everyone has to be, have that history, but like actually it helps you a lot.
yeah,
And I felt like, but I still love surgery. And honestly, frankly, I think surgery needs a little bit of a reboot more than other field. Obviously a lot of medicine does, but like I think surgery is like behind than a lot of other subspecialties of medicine. And I'll just leave it at that without getting too specific. But
yeah.
like, you know what I mean?
We'll allow the
Frankly, they
audience's
need
mind
me.
to just drift and imagine how they think that point will
Yeah, and
evolve.
it's systemic, but also like at the individual basis level too. So like, but there are some things I have in my mind for again, getting back to the like not complaining unless I have some ideas. It's like I do have those things as well, which I'm working on. Again, that's like one of the other beauties of all this having happened is that I since I have been more public with stuff and people have to decide for themselves whether they want to be. For me, it actually was very cathartic and stuff's out there already about me. So I was like, well,
Yeah,
I should be the one to like have my own narrative, like not
yeah,
just
for
some
sure.
random, you
Yeah,
know, 30-page document that's like all legal jargon. I guess my point is like since I've done that, like opportunities have opened up and I've also just been able to like connect with people like yourself
yeah,
and Frances Mays and the Amy Vertrees of the world who bring each other up, like
Yeah.
empower each other. And that's like amazing to have. So I appreciate very much what you do. And I would say for anybody who hasn't gotten into coaching and stuff, I would say like we all need it to some degree, and get it while things are going well, or at least not horrible, because it's going to be, times of crisis, it's much harder. And I guess that would be whether it's coaching or help of any kind.
Well,
Yeah, so I guess those would be like my parting words.
I appreciate it. I mean, this is such a helpful discussion, and we could talk for so much
I know.
longer. And I'm sure, well, as things evolve, I'd love to have you back on, and
Yeah.
as you continue to progress. And for those people who do want to follow your journey and also connect with you, what's the best way to do that?
I'm on LinkedIn, Instagram, and Facebook. I get the notifications on my phone either way for all of them. So either of them, for all of them, if you just search Courtney Barrows McKeown, they can also reach out to you, and you can feel free to send
Just
my
yell Marco really loud.
yeah,
Marco
Marco.
Polo.
Exactly. But no, I'm always happy to talk to people, not just about like I don't know, like opportunities, but like if there's somebody who heard this that relates and just needs like a compassionate ear. I mean, honestly, that's like the most rewarding part. And honestly, the way the probably the biggest honor compliment someone can give me is having somebody else that they is struggling reach out to me. Like that's part of what helps me stay the way I am too, is that not everything's about me. It's like being of service to other people, and for no like motivations other than to just help. Absolutely happy to bend an ear.
Well, thank you. And I do hope the audience finds this helpful. And as you've heard it, if you think someone else would benefit, please let them know that this discussion's available and share it with those who might find value. So again, thank you so much for being here, Courtney. And for the
Thank you.
audience, please share any questions, comments, or insights down below. And until next time, thanks for being here.